Austin and Travis County has joined a seemingly growing number of cities and counties that have positive cases in their area. Austin Public Health has received 2 presumptive positive cases of COVID-19 overnight in our jurisdiction. These represent the first 2 cases in our area. At this stage, the information is limited, and we will share more information as we have it and is necessary to share to protect the health of the public. For now, we have one male in his 60s who is hospitalized in our area. The other, a female in her 30s, who is being quarantined at home. Our epidemiologists are working around the clock to track these individuals, their contacts even before they got sick. But at this stage, these do not represent community spread of the disease, which means they're epidemiologically linked to another case or to another jurisdiction. One of the cases is epidemiologically related to a case from the Houston area. The other case, the individual was transferred to a hospital here from a different region of the state. We have no evidence of that person was ever outside a hospital within the city of Austin or Travis County. I mentioned the one individual is at home and under quarantine. There are other individuals in that home. Our teams are doing surveillance on those individuals. They've been under monitoring since we identified the need to test this individual, and we may do additional testing and will do additional testing of those individuals in the household. All those individuals either have no symptoms or are having mild symptoms at this stage, including the confirmed case. So if you recall, we have a 5-phase plan which is located on our website, www.austintexas.gov/COVID-19. This moves us from phase 2 to phase 3, which means we have confirmed cases. If we have evidence of limited person-to-person spread, for instance, if a person in the household were to be tested positive, that would be phase 4. Phase 5 is that community spread or outside of an isolated or close contact. As we get you more information, it's important to remind the public what our strongest defense is, and that is in that simple hand hygiene messaging. I've said before and I'll say again, we don't yet have a vaccine. We don't have an identified treatment, although we have folks around the world working hard to try to identify a treatment. We're trying to identify medications that can be given in the case of exposure or to be given to healthcare workers and first responders to help prevent the spread of disease. But until then, our strongest defense is those simple messages: washing your hands, not touching your face, cough or sneezing into a bent elbow, and most importantly, staying home if you're sick. We're fighting 2 epidemics right now. One is COVID-19 and the other is fear. We have faced adversity before, individually, as the community, and we can choose 2 paths at this stage. One path is to choose fear and panic. The other path is to choose strength and resiliency. We have to choose strength. We have to choose strength. And that means we need people to start planning. We need them to do things which are reasonable to mitigate this risk, to prepare themselves, their family, and to not spread rumor and panic. We have this under control. We have plans. We have engaged partnerships with all of our healthcare systems, with our city and county government, with our local governments from around Travis County and around the region. We are standing strong together, and we must act as one community and one government to do better and to weather this storm.